The following information has been developed by the Blue Heron Academy of Healing Arts and Sciences, one of the nation's leading schools of massage therapy, complementary and alternative medicine, in conjunction with the American Medical Massage Association. Therapeutic modalities is an important area of massage practice, since hourly, the massage therapist is called upon to make choices between the numerous adjunctive techniques and therapeutic procedures that are related to the clinical care of their patients. We hope that the information provided in this course will assist you with the safe and effective care of your patients. Welcome to this presentation on therapeutic modalities for the medical massage therapist. Hello, my name is Sandra Bovee, and for the next few minutes, we are going to talk about therapeutic modalities. The purpose of this course in therapeutic modalities in massage therapy is to impress upon you the importance of developing a clear understanding of the use of various kinds and types of adjunctive therapy modalities, including hot and cold, percussion and vibration devices, and low-level laser. Within the construct of this presentation, and in an engaging and provocative format, you will learn knowledge of physiological effects of various therapeutic modalities, how to choose the most appropriate modality, how to apply therapeutic modalities within proper guidelines, appropriate patient education skills with utilization of therapeutic modalities, and a structured treatment program for an injury utilizing appropriate therapeutic modalities. Manual therapy is a historic method of healthcare whose heritage goes back several thousand years. In the 5th century BC, at the famous Natural Medical School and Hospital on the island of Kos, was born the great Hippocrates, whose writing and practice of natural medicine included massage therapy, manipulation, diet, nutrition, and herbal medicine, as well as various therapeutic modalities including hydrotherapy, exercise, and mechanical traction. Natural physicians, massage therapists, and bone setters from cultures around the world have employed these same therapeutic modalities and manual therapy treatments until the current time. Conventional physical therapy as an organized profession is about 90 years old and has borrowed many of the techniques of traditional medicine, massage therapy, and manual therapy. The medical massage therapist's use of therapeutic modalities such as hydrotherapy or therapeutic exercises is simply a continuation of their heritage in traditional natural medicine. All global cultures have developed systems of traditional medicine that contain elements of massage therapy, herbal medicine, therapeutic exercise, hydrotherapy, and many natural means of treating human suffering and disease. East Indian yoga and Chinese Tai Chi Chuan are examples of cultural forms of therapeutic exercise used as physical therapy in other countries. The medical massage theory of treatment is based on the hypothesis that the tissues and systems of the body respond best to therapies that work in concert with the natural processes and functions of the tissues and systems. That is, the body best responds to treatments that are most like the body's own natural processes. The medical massage therapist recognizes that all forms of therapy cause some form of stress to the cells and tissues, but the medical massage therapist works to reduce that stress to its lowest level of interference. In the words of Hippocrates, first do no harm. The medical massage approach to therapeutic modalities recommends only those modalities that are the least invasive, and so therapies such as ultrasound and diathermy are not included in this course. Current scientific research questions the effect of deep heat from ultrasound, diathermy, and lasers on the DNA and RNA of the cell. In addition, there are currently many questions regarding electrotherapy's effect on nerve and brain tissues. Medical massage also embraces the latest research on the role of nociceptive input and pain and the importance of stimulating the mechanoreceptors that dampen nociceptive input. The medical massage therapist recognizes several physiological avenues of clinical response in connective tissue that result from manual therapy, including mechanoreceptive and nociceptive somatosensory responses, direct effects on the microanatomy of the cell, regenerative capacity of connective tissues, ligaments, and the joint complex, and biochemical hormonal pathways such as natural opiate production and neurotransmitter release. Therapeutic modalities may be employed in clinical practice by the medical massage therapist in order to achieve certain specific therapeutic goals during the treatment of a patient. Therapeutic modalities include the following physiological methods of treatment. 1. Cryotherapy, or the use of cold applications and the physiological principles of cold in the treatment of physical conditions. The physiological effects of cold therapy may include: it decreases pain, decreases edema, decreases acute or chronic inflammation, decreases muscle spasm and nerve spasticity, and decreases circulation or increases circulation, slows down cellular metabolism, an analgesic effect on trigger points. 2. Thermotherapy, or the use of either superficial or deep heating applications in the treatment of physical conditions. The physiological effects of heat include: decreases pain, decreases muscle spasm, decreases chronic inflammation, increases circulation and vasodilation, increases joint range of motion, increases tissue extensibility, and promotes overall patient relaxation. 3. Actinotherapy, or the use of light, specifically actinic and photochemical rays in the treatment of physical conditions. The physiological effects of light therapy include: decreases pain, decreases edema, produces photochemical effects, and facilitates tissue healing. 4. Hydrotherapy, or the use of water in the treatment of physical conditions. The physiological effects of water therapy include: decreases pain, decreases edema, increases circulation, reduces acute and chronic infection, and provides passive exercise compression to tissue. 5. Mechanotherapy, or the use of mechanical equipment to facilitate movement in areas of the body. The physiological effects of mechanotherapy include: decreases pain, decreases edema, decreases muscle spasm, decreases inflammation, and increases circulation. The medical massage therapist has a variety of therapeutic modalities to choose from when treating a patient. The selection of a therapeutic modality is based upon clinical criteria that includes: what is the cause and nature of the condition being treated? What are the treatment goals? What is the physiological effect or capability of the therapeutic modality? What contraindications and/or precautions apply to the patient's condition? And what is the expected effectiveness of the modality? The answer to these questions will result in the selection of a specific therapeutic modality or a combination of therapeutic modalities that will be used to treat the patient's condition. Patients will be seen and treated while manifesting the following 3 clinical stages. 1. The acute stage, which is characterized by vascular changes, exudation of cells and chemicals, clot formation, and early fibroblastic activity. This is the acute inflammatory stage, and the classical signs of inflammation will be present. These include heat, swelling, pain, and redness. The therapeutic goals in the acute stage are the reduction of inflammation and gentle range of motion. 2. The subacute stage, which is characterized by removal of noxious stimuli, growth of capillaries into the area, collagen formation, and tissue granulation. This is the stage of healing and repair. The therapeutic goals continues to be the reduction of inflammation and gentle range of motion to encourage normal connective tissue remodeling. And 3. The chronic stage, which is the stage of tissue remodeling and maturation, characterized by contracture of scar tissue and collagen realignment. The therapeutic goal in the chronic stage is to restore normal function via complete reduction of inflammation and normal range of movement. The factors that affect the above 3 clinical stages of healing and repair include the type and extent of the injury, the age of the patient, and the patient's current overall state of personal health. The medical massage therapist must establish reasonable and measurable treatment goals based on the patient's injury and physical condition. The primary goals of medical massage therapy with the use of therapeutic modalities is always the reduction of acute or chronic inflammation, especially edema, and the restoration of normal range of motion. Additional goals include the facilitation of tissue repair and increased strength in muscle, ligaments, and other connective tissues. In selecting and applying a therapeutic modality, the medical massage therapist must consider the following contraindications and precautions. Is the physiological effect of the modality counterproductive to the treatment of the condition? What is the patient's history? What is the condition that is being treated? What is the physical status of the patient? And how does the patient's age factor into the treatment? And the following physical indicators must also be considered: pain sensitivity, pregnancy, pacemakers or metal implants, seizure disorders, skin conditions, reactions to treatment, psychological status, medications, infectious illnesses, cancer, location of target tissue, and handicap. Cryotherapy is the use of cold applications and the physiological principles of cold in the treatment of physical conditions. Cryotherapy is indicated in neuromusculoskeletal conditions, acute tissue trauma, or chronic active inflammatory conditions. Contraindications to cryotherapy include impaired circulatory conditions, Raynaud's disease, coma, cold hypersensitivity or allergy conditions, desensitized areas, acrocyanosis, skin rashes, cold allergy, advanced diabetes. Use caution when treating the following conditions with cold therapies: cardiovascular disease and conditions, hypertension, coronary artery disease, Buerger's disease, frostbite, multiple myeloma, nerve palsy. The following methods of cooling are recommended for use by the medical massage therapist: ice pack, cold gel pack, chemical cold pack, ice massage, gel pack with percussion, and cooling liniment application. Frostbite occurs when the subcutaneous temperature falls below 55 degrees Fahrenheit. When preparing to treat a patient with a therapeutic modality, always do the following: discuss and explain the treatment and length of treatment with the patient. Specifically discuss the stages of sensation that they will feel during the treatment session: coolness, burning, aching, and numbness. Instruct the patient to remove all jewelry and metal items. Place the patient in a comfortable and relaxed position. Check the area to be treated for contraindications. Clean the area to be treated with alcohol, and apply surgical draping technique around the area to be treated. The following discussion will describe the procedures used for the specific application of cold therapy. The cold pack. Obtain a cold pack. Place one layer of a small hand towel that has been dampened in cool water over the target tissue. Place the cold pack on the dampened towel. Place another hand towel over the cold pack. Position the towels so that the cold pack does not directly touch the patient's skin. A 2 to 3 pound weight may be placed directly over the cold pack. Leave the cold pack in place for 15 to 20 minutes. Check the cold pack and the underlying target area periodically for physiological effect or contraindications. And when the treatment is completed, remove the cold pack and toweling and dry the area that has been treated. Ice massage. Ice massage involves the use of water that has been frozen in a small paper or plastic cup. The paper or plastic is torn partially away, exposing the ice, and the ice is rubbed in a circular or back and forth motion over the area that is being treated. Obtain an ice cup. Use surgical draping technique to absorb melted ice water and to protect the patient's clothing. Apply the ice cup directly to an area about 6 inches in diameter. Apply in a circular or back and forth motion. The treatment time is from 5 to 10 minutes, and the speed of the ice application is 2 to 4 inches per second. Do not use heavy pressure. Observe skin changes during the treatment. Watch for frostbite. Monitor the patient's subjective clinical changes from coolness to numbness, and, after the treatment, dispose of the ice cup and inspect and dry the treatment area. Gel pack with percussion. Obtain a cold gel pack and a mechanical percussion device. Apply a damp hand towel directly over the patient's target area. Apply a cold gel pack over the hand towel. Apply another dry hand towel over the cold gel pack. Begin mechanical percussion directly over the cold gel pack application. Please note that the cold gel pack can be assembled from a single large folded towel to prevent the pack from coming apart during movement. To reduce the percussion penetration into the tissue, additional towels may be added above the gel pack. Treatment time over an area is from 5 to 10 minutes. When the treatment is completed, remove the treatment materials and inspect and dry the treatment area. Cooling liniment application. Obtain a cooling liniment spray bottle. Carefully drape the area surrounding the target area. Surgical gloves may be used to prevent the numbing effects of the liniment to the therapist's skin. Fold a towel over the patient's eyes to prevent spray from getting in their eyes. Spray the target area with the liniment, allow to air dry, and spray the area again. Repeat this process 4 times. Allow the area to air dry after final spray is applied and leave area untouched for 15 minutes. And rub the area dry and remove excess liniment after 15 minutes. Thermotherapy is the use of either superficial or deep heating applications in the treatment of physical conditions. Heat therapy is indicated in musculoskeletal and joint complex disorders. Contraindications to thermotherapy may include bleeding or hemorrhagic tendencies, acutely inflamed or areas of injury with edema and fluid accumulation, malignancy, skin rashes, thin skin or over bony prominences, desensitized areas, varicose veins, areas of impaired vascular function, and fever. The following methods of heat application are recommended for use by the medical massage therapist: moist hot packs, hot gel or bead packs, chemical hot pack, hot patches or plasters, electric heating pads, castor oil hot pack, hydrotherapy, infrared lamp, and paraffin. The therapist should watch for 2 abnormal clinical effects of heat application. Mottling effect. Mottling is when the treated area becomes blotchy or has white and red patches. This indicates an overexposure to the heat, and the heat should be discontinued when the mottling effect appears. Rebound vasoconstriction. Rebound vasoconstriction is when an area of tissue has been overheated, possibly in excess of 30 minutes, and the increased tissue temperature is causing tissue injury and blood stasis. When preparing to treat a patient with a therapeutic modality, always do the following. Discuss and explain treatment and length of treatment with the patient. Place the patient in a comfortable and relaxed position. Instruct the patient to remove all jewelry and metal items. Check the area to be treated for contraindications. Review possible contraindications with the patient. Clean the area to be treated with alcohol, and apply surgical draping technique around the area to be treated. The following discussion will describe the procedures used for the specific application of heat therapy. Moist heat packs. Obtain a moist heat pack. The hydrocollator pack is applied at a temperature of 150 to 170 degrees Fahrenheit, so there is a risk of scalding the patient's skin. The hydrocollator pack is prepared with 6 to 8 layers of heavy toweling covering the pack so that the patient will not be burned. The pack is applied to the treatment area and may be left in place from 10 to 20 minutes. Once the pack is applied, the patient and the treatment area are checked at 5 and at 10 minutes for problems or clinical effect. And when the treatment period is completed, remove the hot pack and dry the area. Electric heating pad. Obtain a thermophore pad. Place 1 or 2 layers of towel directly over the patient's skin and treatment area. Place the thermophore directly over the towels and place additional towels over the thermophore. Give the on and off switch to the patient and instruct them in its use and provide instruction as to the degree of heat sensation and length of time of the heat treatment. The thermophore treatment is applied for 15 to 20 minutes. A weight or heavy towels may be placed over the thermophore to hold it in place, and at the completion of the treatment, remove the heating pad and towels and dry the treatment area. Hot gel or bead packs. Hot gel or bead packs are used in the same manner as the electric heating pad. Hot gel or bead packs are heated in a microwave oven. Chemical hot packs. Chemical hot packs are used only when the previous methods, moist heat packs, thermophore, hot gel or bead packs, are not available, such as at outdoor sporting events or while traveling. Chemical hot packs are used in the same general manner as the previous methods. Hot patches or hot medical plasters. Hot patches or hot medical plasters are available from Oriental medical supply companies, and they are applied directly to the skin of the treatment area. These medical plasters contain herbal preparations that are analgesic, sedative, and anti-inflammatory. A common problem with these patches is skin irritation or rash. Paraffin bath. The paraffin bath has a temperature range of about 125 to 130 degrees Fahrenheit. A paraffin bath provides about 6 times the heat of water. The paraffin bath may be applied in a number of methods including dip and wrap, immersion, painting, or pouring. The dip and wrap technique is the most commonly used technique for paraffin application. First, prepare the paraffin tub. Second, the body part to be treated must be thoroughly cleaned and dried prior to paraffin immersion. Third, dip the body part into the paraffin and remove. Fourth, allow the paraffin to cool slightly and dull before redipping the body part into the paraffin bath. Fifth, redip the body part 10 times. Sixth, cover the part in a plastic bag and then wrap in an insulating towel for 15 to 20 minutes. And last, at the completion of the treatment, remove the paraffin and put it back into the paraffin tub. At the completion of the paraffin treatment, the body part is massaged and mobilized. In the immersion method, the body part is dipped 10 times and then left in the paraffin bath for 15 to 20 minutes. When the immersion treatment is completed, the paraffin is removed and put back into the paraffin tub. The body part treated is then massaged and mobilized. Infrared lamps. The infrared lamp is a device that contains a heating element that is heated to a high temperature, and the resulting heat then radiates to the body area that is being treated and is absorbed by the body surface. Infrared heat produces the following physiological effects. It reduces muscle spasm, increases local blood flow, increases tissue metabolism and white blood cell phagocytosis, reduces pain sensation, and stimulates the diaphoretic effect. Some of the advantages of infrared heat are that it does not require much physical preparation, no weight is placed on the patient because there is no direct contact, the risk of scalding due to hot water or steam is removed, and the amount of heat applied is easily adjusted by an adjustable dial, insulating material, or the distance the lamp is placed from the patient. Although infrared lamps are available with light bulbs, only the metal element type of infrared lamp is recommended for use. Infrared heat may produce an uncomfortable itching sensation in the patient, and contraindications include malignancy, skin rash, advanced cardiovascular disease, and desensitized areas and new scar tissue. Technically, infrared lamp treatment includes sun lamps. These ultraviolet spectrum lamps are used primarily to treat infections of the skin. Standard infrared heating element lamps are indicated in the treatment of subacute and chronic traumatic and inflammatory conditions, musculoskeletal conditions, contusions, muscle strains, sprains, and tendinitis, many forms of arthritis, excluding rheumatoid arthritis, neuritis and neuralgia, circulatory conditions of the extremities, and prior to medical massage or manual therapy treatment. Instructions for infrared lamp use. First, obtain an infrared lamp and connect it to a power source. Second, educate the patient regarding the treatment and the need not to move, bump the lamp, or touch it in any way. Third, adjust the heat dial on the lamp to the desired level of heat. Fourth, position the distance of the heating element and the angle of radiation at the treatment area. Fifth, leave the lamp in position and check the lamp at 5 and 10 minutes. Sixth, the treatment is performed for between 10 and 20 minutes. Seventh, evaluate the treatment area for modeling effect and clinical response. And eighth, at the completion of the treatment, turn off the lamp, move it out of the way, and caution the patient to stay away from the lamp, which will remain hot for several minutes. Actinotherapy is the use of light, specifically actinic and photochemical rays, in the treatment of physical conditions. This treatment modality involves the use of light and not heat when low-intensity lasers are used. The physiological effects of light include: it decreases pain, decreases edema, produces photochemical effects, facilitates soft tissue healing, increases local blood flow, and stimulates immunological responses. Actinotherapy may be applied by various sized laser devices, from handheld to table units. The fact that low-intensity laser therapy utilizes light and not heat makes it a useful therapy for inflammatory conditions where heat is contraindicated and cold may not be tolerated by the patient. Low-intensity laser light therapy is applied with the same procedures as infrared treatment, but without the concerns of overheating or burning the patient. Laser therapy may also be used on acupuncture points. Actinotherapy is indicated in the following conditions: muscle spasm, localized inflammation, active trigger points, and skin rashes or infection. Actinotherapy may be applied to an area from several minutes to 15 to 30 minutes. Neither the therapist or the patient should look directly at the device which is placed in direct contact with the area to be treated. It is recommended that the patient's eyes are covered during the treatment period, especially when leaving the patient unattended. General preparation procedures for the application of laser modalities. First, discuss and explain the treatment and length of treatment with the patient. Second, discuss what sensations the patient may feel during the treatment. Third, instruct the patient to remove all jewelry and metal items. Fourth, place the patient in a comfortable and relaxed position. Fifth, clean the area to be treated with alcohol. And sixth, apply surgical draping technique around the area to be treated. Contraindications of light therapy include malignancy, directly into the eyes, and photosensitivity of the skin. Hydrotherapy is the use of water in the treatment of physical conditions. The physiological effects of water include: decreases pain, decreases edema, increases circulation, reduces acute and chronic infection, and provides passive exercise and compression to tissue. Hydrotherapy involves the use of either hot or cold water or contrast baths. Water temperatures may range from 55 degrees Fahrenheit to 105 degrees Fahrenheit. The temperatures used for contrast baths are cold, 55 to 65 degrees Fahrenheit, to hot, 98 to 105 degrees Fahrenheit. Hydrotherapy has been and continues to be used as a therapeutic modality for centuries and by many global cultures. The hydrotherapy techniques in this section are only the specific techniques used to treat musculoskeletal disorders and not the wide and diverse techniques and procedures that compose the entire science of hydrotherapy. Hydrotherapy application works through the physical principles of buoyancy, heat and cold, and mechanical compression or effect on the body tissues. Hydrotherapy can be used to produce the following physiological effects: sedative, analgesic, hyperemia, mechanical, cleansing, and metabolic. Hydrotherapy may be employed to treat acute, subacute, and chronic conditions, trauma and inflammation, sprains, strains, joint complex stiffness, arthritis, and tenosynovitis, nerve injury, circulatory stasis, lymphedema, burns, and skin ulcers. The contraindications and precautions of hydrotherapy include active bleeding and open wounds, malignancies, skin rashes, hypertension if heat is used, and advanced cardiopulmonary conditions. Treatment times using hydrotherapy range from 10 to 30 minutes. Hydrotherapy is more work-intensive and more time-consuming for the therapist. It is also less convenient for the patient since it requires disrobing and drying procedures. The two most common techniques employed in medical massage therapy for hydrotherapy application are the whirlpool and the contrast bath. The whirlpool bath. The whirlpool bath utilizes the physical properties of water in regard to both temperature effects and mechanical effects of hydromassage. The water temperature ranges between 98 degrees Fahrenheit and with partial immersion of a body part, not more than 115 degrees Fahrenheit. Treatment times range from 10 to 20 minutes. Whirlpool therapy is used on conditions where the therapist wants to combine the effects of thermotherapy with the mechanical stimulation or massage of the connective tissues. The contrast bath. A contrast bath involves the use of both hot and cold water, and it is used primarily on subacute and chronic musculoskeletal conditions of the extremities. The physiological purpose of the treatment is to stimulate local circulation and movement of body fluids. This technique is especially good for the treatment of lymphedema. Contraindications to the contrast bath include cardiopulmonary conditions, Buerger's disease, and arteriosclerosis endoteritis. Contrast baths are applied in a ratio of 4:1 heat to cold. For example, hot immersion 8 minutes, cold immersion 2 minutes, hot immersion 4 minutes, and cold immersion 1 minute. For subacute and chronic conditions, the treatment usually ends with hot immersion. General preparation procedures for application of hydrotherapy modalities are 1. Discuss and explain the treatment and the length of treatment with the patient. 2. Discuss and explain the disrobing procedures. 3. Instruct the patient to remove all jewelry and metal items. 4. Position the patient for the treatment. And 5. Provide the patient with towels for drying after the treatment. Mechanotherapy is the use of mechanical equipment to facilitate movement and tissue metabolism in areas of the body. This equipment includes exercise equipment, soft tissue vibrators or percussion devices, massage beds, and mechanical traction units. Vibrators and percussion devices can be used for the following clinical objectives: to reduce trigger points, decrease muscle spasm, increase soft tissue circulation, decrease muscle fatigue and stiffness, increase joint mobility, reduce connective tissue adhesions, and reduce interstitial edema or joint effusion. These mechanical devices come in two types: those that primarily provide vibration and those that primarily provide percussion. A percussion device is marketed under the trade name of the thumper. The percussion devices are helpful with patients who have marked clinical obesity or a very large soft tissue body mass. The percussion devices can also be used with a cold gel pack to produce a deep ice massage. When using the percussion device, it is a good idea to use from 1 to several layers of toweling to prevent soft tissue injury. Also avoid percussion over bony articulations or joints without using several layers of toweling as protective insulation. Contraindications for the use of vibrators and percussion devices include fractures or suspected fractures, malignancy, thin skin or over bony prominences, varicose veins, blood clots and thrombophlebitis, abdominal area during pregnancy, abdominal area during menstruation, pulmonary tuberculosis, cardiovascular disease such as angina, arrhythmia, hypertension, or atherosclerosis, overacute inflammation, skin rashes, acute trauma injury and/or bleeding, and nerve spasticity or nerve root irritation. In general, the vibratory devices can produce more contraindications due to oscillation on the horizontal plane, and the percussion devices, which operate on a vertical plane, more effectively imitate manual massage therapy technique. Percussion devices are good for the treatment of lymphedema and pre- and post-treatment at sporting events. The following percussion treatments may be applied for the time periods indicated. Ice massage, 2 to 10 minutes. Lymphedema, 2 to 15 minutes. Trigger points, 5 to 10 seconds. Muscle spasm, 10 minutes. Joint facilitation, 10 minutes. And general relaxation, 5 minutes. The following information describes the procedures used for the specific application of heat therapy. First, discuss and explain treatment and length of treatment with the patient. Second, specifically discuss the sensations the patient may feel during the treatment. Third, instruct the patient to remove any jewelry or metal items. Fourth, place the patient in a comfortable and relaxed position. Fifth, check the area to be treated for contraindications. And sixth, use toweling to protect the patient as is necessary. Thank you for your participation in this audio training program on therapeutic modalities. As has been indicated in this introductory presentation, therapeutic modalities have been used safely and effectively to treat the aches, pains, and ills of mankind for thousands of years. We hope that you will now be able to use a few of these fundamental therapeutic modality techniques for the benefit of your patients.